Today I think we're going to cover a very important topic, that is women and liver health. So, Dr. Ankur, I would like to understand from you that is it hyped liver disease, what I'm hearing from everybody around me, or seriously there's a hike in cases for liver?
Yeah. So see, hype about liver disease, yes, from a common man notion, it seems so because every now and then, whenever we visit maybe our family physicians or something, there's a hype. There's a very common thing that gets added to our diagnosis of fatty liver, apart from whatever other illnesses we have.
Right.
So, being a doctor from that perspective, I just want to share that it's not only a hype; it's a true sense. It's a silent pandemic, what we call as the fatty liver is a silent pandemic
Okay.
which is eating the world around. So going back, 15, 20 years back, there was hardly maybe 4 to 5% of the liver transplants which used to be carried for fatty liver related liver failures, and
Right.
that percentage has touching 15 to 20% now.
Okay.
Of course, there are a lot of confounding factors. So truly label somebody with fatty liver failure, he will have some effect of diabetes, he will have some effect of alcohol as well. But yes, it's not a hype. It is definitely a silent pandemic, which is a boon to us of our changing lifestyles and health
But
habits.
as you said, it was before also 20 years back. But the number of cases were the same then and now.
See, I'm saying about among the percentage of liver transplants. Suppose 100 liver
It has
transplants are
increased.
happening today. So 20 years back, only 5 used to be for fatty liver failure. Today, that number is touching 15 to 20%, and it is only increasing by the number of years, as I'm seeing.
Maybe it's detected more. People are coming to know more about it. Maybe it's,
one possibility, yes, more awareness, but there is no doubt about it that fatty liver related liver issues are definitely increasing.
So, what is the reason for this?
So the reason, I think we all are very well aware of it. Our lifestyles are changing patterns, hardly any physical activity. And personally, being there in North India for almost last 15, 20 years now, I see North Indian living styles are more of carbohydrate rich diets. A lot of sweets we like to eat. So it's less of protein and more of carbohydrates.
Carbs, yes.
So ultimately, those carbs are going to get converted into fat. The way they get deposited on our belly, the same way they get deposited on the liver as well. So, and of course, changing lifestyles, lot of eating, lot of partying, irregular timing, meals, and of course, increase in alcohol intake.
So you say that healthy lifestyle is what is required to maintain.
I think the whole world says about it.
We know it.
Yeah,
so, okay. So my question will be like, how to get aware about it? How to know that I have a fatty liver? One should get tested for this. So how will one come to know? It's and how frequently one should get test for this kind of thing?
See, fatty liver per se, if you think about that, okay, I can get my liver function test done. So, liver is a very resilient and a organ which has a good reparative capacity. So, unless 70% of the liver is damaged, liver functions remain normal. So, it's an address to all of you people, watching this, and don't be in this disbelief that my LFTs are okay, so my liver is okay. Because LFTs will go haywire only when 70% of the liver is damaged.
And what are the symptoms one face when they come to you? What kind of things they see and then they come to you?
So there is one subset of population, which is more aware about their health. They will come that, okay, we have fatty liver, we got an ultrasound.
But how will they come to know? What are the symptoms
No,
of the same?
per se, they will not have any symptoms as such, fatty
Okay.
liver. As I told that 70% liver till the time is damaged, the patients will not have any symptoms and their test will be more or less absolutely normal.
Oh.
So if you're talking about liver failure patients, they come to me when they are in a very bad
advanced
shape.
stage.
Very bad shape. But the other category of patients which come to me, they come with their concerns that, okay, I got my ultrasound done due to some other reason, maybe, a urine problem or a stone problem.
In that it is detected.
In that it is detected fatty liver. So just to go by the dynamics, if we screen randomly, say 100 people walking on the road, I think 40-50% will come as fatty liver.
Okay.
Yeah. But whether to address it there, whether to leave it, that's something, let's see in our discussion where it goes.
Okay. So I have something like a word called non-alcoholic fatty liver. So as you said, there is a lot of changes, alcohol, a lot of other things. So why, if somebody is not having alcohol also, then also they, other reasons, what are the...
See, alcohol is only one reason which can cause our liver damage. So what we call as alcoholic liver disease. This term, a broad term or a common term, what we call is fatty liver. Ultimately, technically, it is called as non-alcoholic fatty liver disease. Because alcoholic liver disease also causes fatty liver. Okay. But that is due to the side effects of alcohol. So it's not that only alcoholic people can get fatty liver.
So what are the other reasons?
Other reasons are definitely...
Lifestyle you said, because a very broader term. But lifestyle you said, I think, but what are the...
imbalanced diet, imbalanced physical activity, obesity, diabetes itself is a risk factor. And with age, people's activity levels and the BMI keeps going down as the age increases.
Right.
Definitely.
So there are other body problems also somebody can aggravate the problem for liver also. There's other part from the lifestyle.
Yeah, our body is like a car engine. One part goes off, it definitely has a strain on the other part. There is no doubt about it. So same way our body, be it liver or heart or kidney, if one organ is damaged, it will definitely have some impact on the other organ as well.
Okay, perfect. That sounds good. Okay, so and what are the common issues that women experience during pregnancy?
So pregnancy is a state, where there are a lot of hormonal changes in women's body. So not only about weight gain, one weight gain is because the baby is growing, but apart from that, there's a lot of fluid retention and a lot of other hormonal changes. So, cholestasis of pregnancy, something is a very common thing that we may come across at least 10 to 15% of the pregnant females. A lot of females will have a lot of itching during their...
Which term you use?
Cholestasis. Cholestasis means retention of bile.
Okay.
So, people have itching. And they may have slight bilirubin rise, slight jaundice in their eyes. Okay. So most of the times it's a benign thing, and with the delivery of the baby and the termination of pregnancy, it gets settled down. But yes, there can be acute liver failure of the pregnancy related also. And so pregnancy is a group where there is a whole set of things, people can have.
A lot of changes, yeah.
Yes. So 90-95% what we see in our community, we see it in our families, in our own life. They are okay, they're milder things. But yes, 2 to 3% of the women can suffer with severe liver failure.
So how to avoid that?
If we talk about avoiding liver failure or avoiding any liver issue during pregnancy, I think the best is to go with a proper antenatal care as per the schedule with the gynecologist. So she will take care of it, getting your LFTs done, get your ultrasounds done on time, and anything will be picked up on time. So that's the only thing that we need to avoid. There is nothing special that we need to take care of liver in the pregnancy, but we should be knowing that yes, there is this issue that exists.
Okay, madam, you have to take care of your liver, your health. This thing also has to be taken care of. That you get, if the doctor is not taking reports, so you have to ask them that.
Yes, a good gynecologist, if
obviously
they will
get it done.
They'll
get it done. That is habitual kind of records that they maintain. That's perfectly fine. So one more thing I want to ask you, that why this pre-menstrual women face less, and post menopause they face more problem for liver. Why is that so? Is there any particular reason?
See, not a very clear cut. Yes, some literature exists that post-menopausal women. So see, because menopause is something which brings a lot of other changes in a woman's body. So when all the usual hormones, they stop getting produced because of menopause. So it's not only about the liver problem. If you see that post-menopausal women will have more of cardiac issues. They will have a lot of bone density issues because the normal hormones are not there now. Okay. Whereas in men, there is nothing called as menopause that happens. So that is an evolution. That is something, biologically we have been gifted our bodies. So I think going for timely checkups, or if required some hormone replacement therapies for postmenopausal women, they should be actively considered. So it will not only prevent their liver health, it will prevent their cardiac health, their bone health as well.
So any supplements should be taken in after post-menopause? Something you suggest which avoids this kind of problem to happen?
Socioeconomic strata we belong, I don't think so we have any deficiency of any food as such. Almost everything is available to us. So if we take a well-balanced diet, per se we should not be requiring any nutrition unless there is some special need of the body, be it illness, be it pregnancy, or undergoing some medical procedure. In a routine daily life, I don't think so any of us needs any supplement if we are having a healthy balanced lifestyle and a diet as well.
I understand. That is really, really, really important. Okay.
But yes, popping vitamins is a fad. I think we all do.
Yeah, I don't know why there are a lot of deficiencies still. Vitamin D deficiency, which earlier it was not vitamin E deficiency.
15-20 years back, there was no test to detect that what are the vitamin D levels. What about then?
I know, we always, used to take that sun bath, and now it's a privilege.
So yeah, that is also some part of it is due to lifestyle changes, because there's hardly any sun exposure. We all the time we remain indoors in covered cars. So yes, that is one factor for vitamin D.
There's many other ways. So I got the point that it has to be healthy lifestyle. But other things you want to add to prevent any kind of, liver problems, one face, and at every stage I want to, from the, the small infant to the elderly, at every stage I want to understand step by step, so that at least my viewers should know that at this, because what happened, the kid takes birth and we give them a lot of vaccinations, but after like 10 years, vaccination stops, and they are on their own with the food, what we feed them. But from a doctor perspective, as you say, healthy lifestyle, as I said, this is a very huge term. So everybody has own definitions for this. So from your doctor perspective, I want to understand that every age, what one should take care of in diet, and that little brief you can give us.
See, healthy lifestyle, yes, it's a broad term, but at the same time, we have to see that at what age we are talking about. Whether we are talking about a 10-year-old kid, we are talking about 20-year,
Yes.
we are talking about
Yes.
somebody who's pregnant, we are
Yes.
talking about somebody who's into heavy physical activity. So,
Right.
depending upon the lifestyle or
Yes.
depending upon the age at that which that body
Yes.
is.
Yes.
So, healthy lifestyle, by WHO definition, it is not only about the diet, it's about physical, mental, social,
Right.
and spiritual well being
Right.
also. So, if we talk about, healthy lifestyle, so it definitely covers all the aspects of it, and I think it's very important. So just to keep on going about what kind of diet or what kind of exercise, I think there is no limit or no end to that discussion. Most of us are very well aware, and we all know that what are required for us, but depends how much willing we are ready to follow to that.
Yeah, that I think discipline, I should
Discipline.
say that discipline is not there. That
Yeah.
is, or we join sometimes the trainers, because they will monitor us, and they will be somebody to check on us. Like in school, they were teachers.
Yes.
So I think we also need somebody to motivate
So
us.
we should have our own moral compass check, there, that have I ticked these marks in the day today or not.
And how frequently one should get their checkups done? At what age? Any recommendation? Because time has changed. So from a doctor perspective, how frequently? Because pre-detection of something, as you said, that early detection is important, and people sometimes come to like 70% failure. So what is what do you suggest in that case?
See, talking about a normal man or a normal person in life, if they don't have any risk factors that, if they are not over on alcohol, they are not diabetic, they are not overweight, or they don't have a very strong family history of liver disease. So I will not recommend that everybody now and then should go about their liver test. Yes, 40 is still a age, which I feel is appropriate that we should get one complete medical evaluation.
Okay.
But yes, if there are specific risk factors, alcohol intake, obesity or diabetes, hypothyroidism.
BP also adds to it?
To be honest, BP per se does not have any
Doesn't
effects
have
on
effect on it. Okay.
liver. It can have a lot of effects on kidney and heart, but liver it won't have.
Okay, perfect. Anything you want to add more? Because I think it was a very exhaustive and a detailed understanding about the fatty liver and the problems the women are facing at every stage of life. And Dr. Ankur has been really great in explaining a lot of things that we know, but I think these things have to be addressed again and again, because in spite of knowing all these facts, we don't implement. And until unless we implement all knowledge we have, it doesn't make a difference. So avoid. We can call Dr. Ankur to our places and have some parties, but we don't prefer to be having those kind of problems. But still, maintaining a healthy lifestyle is really important. Any other message you want to give to the Commie family? Because we really look forward that we maintain healthy lifestyle, but still the problem persists.
See, the problem persists today. It existed
Yes.
in the past, and it will continue to persist in
Yes.
the.
Yes.
But probably, hearing these things again and again, it
Yes.
just reinforces. And maybe, with every new talk, whether it
Yes.
is me or anybody else,
Yes.
even if it has impact on, say, 0.5% of the people watching, I think it's a positive impact. So we should continue these efforts
Yes.
about community talks and teaching and, breaking the normal common myths about.
Yeah,
health.
because I think age also plays a big role, because if we have a healthy lifestyle also, but as you're aging, some problems may tend, like my mother also had a fatty liver at an age of 70. So I understand that she has a good life, healthy lifestyle also, not healthy also at some time, because they used to have that laddu pinnis you call. So she used to proudly say that I used to have the roti and I used to have those desi ghee ki pinni, So she very proudly she
Yeah.
used to say that. So she has lived that life also. But at an age, you obviously it comes back, shows up in your health.
Definitely.
So I think this is a part and process of the age also.
Yes, see, aging, we all have to undergo aging, and it will have its own impact on our body
Right.
also. That is one thing.
Right.
But apart, still, I feel that, a lot of diseases can be avoided by just following, very simple things and to keeping a check on ourselves.
Perfectly fine. So I understand that healthy lifestyle we all know, and problems, healthy liver, and getting operated, and putting yourself is not something that all of us don't want. So I think thank you so much, Dr. Ankur,
Thank you so
for
much.
your time, and looking forward for more sessions, more updates, more information for Commie family, because we want that everybody should maintain and avoid these kind of health issues, and we have a healthy society to live in. Thank you so much.
Thank you. Thank you so much.